We ready online, Christian? Okay, great. Well, welcome. Thank you for coming today. My name is Dave Brown, and I'm with TrueLink Medicare Advisors. We are owned by the Minnesota Credit Union Network, which is the trade association for all the credit unions in Minnesota. And this is our third year of working with the Mayo Employees Health Clinic. Most of you, you would have gotten this when you came in, and if you're watching online, you'll get them emailed to you this afternoon. But in that packet is just some basic information on Medicare. There's also a card like this in there. At the end, if you want to meet, just fill out this card and put a date on there when you're going to be retiring or losing your employer coverage, and then we can connect with you. If you do fill this out, I'm just going to send you a thank you email. I'm not going to be calling you, but if you have an email address, if you put that on there, I'll thank you for coming today, and then I'll just ask when is it that you need help. Again, I'm not going to be calling you. If you have an email address, I'll email you, and we can connect that way. So with that, we will get started. I've been doing Medicare now for 18 years. We started the TrueLink Medicare Agency 3 years ago with the Minnesota Credit Union Network. And we've been helping a lot of Mayo retirees with that. So disclosures, we represent all of the Medicare Advantage plans that are available in this area, and we are licensed with many of the Medigap plans and most of the standalone prescription drug plans. And we're going to go over that in a little bit in this presentation. So the basics of Medicare. Anytime during the presentation, if you have a question, just raise your hand and ask as we go along. I'd prefer to do it that way. And if you're online, if you want to enter it into the chat, and then we can answer your question as we go along. So we'll talk about why would you want to work with TrueLink Medicare Advisors. What is Medicare? What does it cover? What doesn't it cover? The different enrollment periods and deadlines, your costs that will be associated with Medicare. What if you're going to work past the age of 65? How does that work? And then we'll go over the private insurance options. So if you're close to the age of 65, you know your mailbox starts filling up with tons of mailings from everybody wanting to help you sell you a Medicare plan. And if you watch TV, especially in the fall, in the months of September, October, November, it's just constant Medicare advertisements. Call this 800 number and we'll be happy to sell your information to somebody else, is how it really works. So, which is one of the reasons we're here. We're a trusted source for Mayo Employees Credit Union, and you can use us. Some of you are going to need to use Via Benefits, and that's a third-party provider that the Mayo Clinic uses. And how that works is if your employment or your spouse's employment, depending on who's the one insurance that you're on, if that employment started prior to January 1 of 2002, you're most likely going to need to go through Via Benefits if you worked for the clinic. Not true if you worked for the health system, but for the clinic you would. And you're going to get health reimbursement money if you do that. And Mayo HR is going to make you aware of that if that's the situation that you're in. If you use TrueLink Medicare Advisors, there's never a cost for our services. We're happy to meet with you and advise you on the different plan options that are available to you, or just answer your basic Medicare questions if you want. Like I said, we offer most of the companies that are available. And then we're available throughout the year if you have questions or need help with anything. And every year during the open enrollment period, and that's October and November, that's the time frame in which if you have a Medicare Advantage plan, you can review options for other plans, or if you have a standalone prescription drug plan, you can review options to see if the plan you have this year is still going to be the option for you for next year. And those are things that we help our clients with. So original Medicare Parts A and B. Parts A and B you're going to get through the federal government, and it's through the Social Security Administration. If you're collecting Social Security benefits at the time you turn 65, you will automatically receive a Medicare card in the mail about 3 months prior to the month of your 65th birth date. Some people are collecting that, but you may have a spouse that's still working, and if you're on your spouse's employer plan, as long as that employer has 20 or more employees, you do not need to be signed up for Medicare Part B. The reason you wouldn't want to be is you're going to pay a monthly premium for Medicare Part B, and you don't need to do that if you're on an employer plan. So Medicare Part A is coverage for hospitalization, skilled nursing, home health care, and hospice. We do have a handout over there if you want, it's up to you. And there's no monthly premium for Medicare Part A. If you or your spouse worked at least 10 years in the United States, then you aren't going to pay anything for your Medicare Part A. The deductibles and copays and that only applies to certain Medigap plans. It's not going to apply to a Medicare Advantage plan. So I won't go into the weeds on that. Medicare Part B provides coverage for doctors and specialists, all the outpatient type things, medical equipment and supplies, ambulance, those types of things. There is a monthly premium that you'll pay once you sign up for Medicare Part B. And this year that's $202.90 a month for most people. If you're in the high income category, and we'll go over that in a minute, then they add a surcharge onto that. But for most folks, it'll be $202.90 a month. Again, that annual deductible typically only applies to certain Medigap type of plans. It doesn't apply to the Medicare Advantage plans in Minnesota. Any questions on that so far? So there are certain things that Medicare doesn't cover. They won't cover comprehensive dental, won't give you worldwide coverage, hearing, vision, fitness benefits, outpatient prescription drugs. Some supplemental plans, some Medigap plans will cover a few of these. Most Medicare Advantage plans will cover all of these. So those are going to be some of the differences between Advantage and Medigap plans, and we'll go into that a little bit more. Medicare enrollment periods. Your first enrollment period is the initial coverage enrollment period. It starts 3 months before the month you turn 65, the month of, and 3 months following. So you have a 7-month window in which you can enroll in Medicare A and B at age 65. However, if you're still working and on an employer plan, or you have a spouse that's still working and on an employer plan, you do not have to enroll in Medicare Part B at age 65 if you're on an employer plan, someone's still working. We have a question, yes.
Somebody online just asked, what does comprehensive dental mean?
Comprehensive dental would mean things beyond your basic cleanings like root canals, crowns, fillings, those sorts of things. Yeah, so if you're in that category of where either you or a spouse is still working at age 65, you may want to sign up for Medicare Part A, but you don't have to sign up for Medicare Part B. You don't want to sign up for Medicare Part A if you're still working, if you're contributing to a health savings account. If you're contributing to a health savings account, you can no longer do that if you sign up for Medicare Part A. So if you're in the category of someone who's still working, you don't want to sign up for Part A if you're contributing to an HSA account. Any questions on that? Okay. And then there's something called a special election period. And this is for people who work beyond the age of 65 or your spouse did. And when retirement comes, you're going to want to start the process of signing up for Medicare Part A and B if you hadn't done that already. 2 to 3 months before you're going to be retired if you're beyond the age of 65 or it's your spouse. And you can do this online at Social Security, ssa.gov. You can contact us and we can help you with you, or you can go to your local Social Security office. But those are the ways you could get signed up for Medicare Part A and B if you hadn't done so already at age 65. And again, start that 2 to 3 months before you're going to retire. Yes?
Got a question on there. If your wife on there is turning 65 next year on there, but she's probably going to work beyond that, does she have to sign up for Part A or not?
Okay, so the question is, if your spouse is going to be turning 65 and continuing working, does she need to sign up for Part A? She probably wants to, as long as she's not contributing to a health savings account. There's no reason not to. You don't pay anything a month for it. She doesn't have to. She can wait until retirement to sign up for both if she wants.
On Medicare's website to do that?
You can go on Social Security's website to do it, and there's an icon at the top that says sign up for Medicare, and it'll ask you, do you want Part B? She would say no if she's still working, and sign up for Part A, and that's all you have to do.
And if you don't want to do Social Security, you can decline that at that point?
Social Security benefits is a separate application, yes. Mm-hmm. Yes, sir.
So, I retired about 3.5 years ago from Mayo, and I switched over to my wife's medical insurance because she's still working at Mayo before I retired. So my question is, she's gonna retire November 2nd. When do I or both of us need to sign up for Medicare A and B? Is it like a month or 2 months prior to that? Or?
I would sign up for Medicare A and B 2 to 3 months prior to when you're going to be losing your employer plan. Social Security, if you go to the Social Security office, it gets processed faster than if you do it online. It takes about twice the time if you do it online, but there's no general rule. I worked with a lady 3 weeks ago and we did it online and she got her card already. So there's not a lot of consistency there, but going to the local office, they do process it a little faster than if you're doing it online, but if you plan ahead 2 to 3 months, you should be fine.
Is there any other stuff that I need to do? Because I turned 65 in June and she does not turn 65 until October.
Yeah, so if you turn 65 in June, if you're collecting Social Security benefits now, they're going to mail you a Medicare card. You're going to want to decline Part B unless you want to pay that $203 a month. Yeah, and they give you directions on how to decline for Part B. And then once your wife retires, that 2 to 3 months before, you can start the process of applying for Part B.
Okay.
Yeah.
So how do we, or who helps us with deciding what Medicare package to take so we can have in-house network through Mayo?
Yes. So we can help you with that. If you're eligible for VIA benefits, they can help you with that too. But if you want 2 opinions, we can help you with that. There's no cost to that. We can give you advice. But if you're going to be getting the health reimbursement from VIA benefits, ultimately you'll need to sign up for a plan through them. Last year they weren't offering any of Medica's plans. I think that they're getting contracted to sell Medica's plans because if you're in Olmsted County, if you want a Medicare Advantage plan, Blue Cross is down to 1 option. If you're in some other counties, you're going to have more than that. But yeah. And then we have a question online.
Yeah, they're just asking, are you penalized if you don't sign up for Medicare Part A?
You're not penalized if you don't sign up for Medicare Part A. It would be for Medicare Part B. The only reason you'd get penalized for Medicare Part B is if you don't have employer coverage. If you don't sign up for, when you turn 65, if you don't sign up for Medicare Part B, it needs to be because either you or your spouse is continuing to work and you have employer coverage that way. When you do, you or your spouse gets ready to retire, there's a form that your employer fills out. It's just, and we're going to take a look at that in just a minute. But that gets submitted with your Part B application, and that's what prevents any penalties for not signing up at age 65. Yes?
Is there any way, if you're drawing Social Security and you start on Medicare, can you have, does it have to be, your Medicare have to be taken out of your Social Security, or can you send in, a payment on there for it?
So if you're collecting Social Security benefits when you sign up for Medicare Part B, they will automatically take it out of your Social Security benefits. There's no choice. They'll do it automatically. Okay, good questions. Once you are signed up for Medicare Part B and you're on a Medicare plan, then there's what's called the annual election period every year. That's from October 15th through December 7th. And again, this is the time frame in which, if you're on a Medicare Advantage plan, you can look at other options that are available to you. Or if you're on a Medigap plan and you have a standalone prescription drug plan, then this is the time frame in which you can look at changing your prescription drug plan if you need to. There's reasons for that. The formularies change, what medications they cover can change from year to year, but this would be the time frame in which you could do that. And then the other enrollment period would be if you're on a Medicare Advantage plan and you decide come January, you didn't make any changes during the annual election period, but you decide in January that maybe it's not working for you well for whatever reason, you can switch to another Medicare Advantage plan every year from January 1 through March 31st. So for people who have Advantage plans, you do have that option. Yes?
Can you just clarify for me the difference between the Advantage and Supplement and Medigap?
Yes, we're going to go over that in just a few
Oh,
slides, but
okay.
yes.
Okay, because Mayo doesn't take the Advantage.
They take two insurance carriers for Advantage. They sent out a letter that was confusing because this year Mayo will no longer accept United Healthcare and Humana Advantage plans. They will continue to accept Blue Cross and Medica Advantage plans.
So is there quite a cost difference between those two, or?
There is, and I'm going to talk about that in just a minute. Yes. Yeah.
Once,
Oh.
and maybe if you're going to get to this, once you're on an Advantage, can you go back to the Supplement?
If you live in Minnesota up until age 70, you can move to a Medigap plan without the health questions, but they add a premium onto the monthly, they add a surcharge onto the monthly premium.
Oh, okay.
Yeah. So again, if you're working past the age of 65, you can compare, are you better off going on to Medicare or keep your employer plan? If you have the Mayo plan, most cases I've run across, you're better off staying with the Mayo plan until you retire. Their plan is deemed credible by Medicare. Again, if you can apply for just Part A at age 65, but if you're contributing to a health savings account, you don't want to do that. Otherwise, there's really not much reason not to. When you're ready to retire, you're going to want to stop contributing to your health savings account 6 months before you're going to go on to Medicare. If you forget and don't do that, there's just going to be some tax. They're going to tax you on your contributions. It's not a huge deal, but if you can remember, then 6 months before, if you're working beyond the age of 65, 6 months before you're going to retire, you're going to want to stop contributing to your HSA account. And a general rule of thumb, if, say, the end of this year, you know you're going to retire sometime next year, when the new plan options come out from Mayo in November, you're going to just want to let them know you want to stop contributing to your HSA account in January, and then if you're retired June or later, you're going to be fine. You can apply for Medicare Part A or B online at ssa.gov. You can go to the local Social Security office. You can contact us, and we can help you with that too. Again, there's a form for Part B, and it's going to look like this, that your employer or your spouse's employer will need to give each of you, if you're both applying for Medicare Part B beyond the age of 65. It's this form that gets submitted when you apply for Medicare Part B that prevents any penalties for not signing up at age 65. And what this form is just verifying from your employer to the government that you had coverage through your employer, and that way you aren't going to be penalized for not signing up at age 65. Any questions on that? You can get that form off the internet. Mayo should have it. You should be able to request the employer verification form. If not, I can email it to you too, but it is on the Medicare website. Yeah. And then there are income impacts once you retire. So if you or someone you know is in the low income category and they're struggling, there's something called extra help that's available. And based on this chart, the family size on the column on the left, based on your family size, and the percentages across the top are the percentages of the federal poverty guidelines. And these numbers are for Minnesota. They're pretty close across the country, but each state kind of sets their own. If your income is below any of these levels based on your family size, you're most likely going to qualify for some sort of extra help. If you qualify for extra help, it's going to lower the cost of your Part B premium, that $202.90, and it's going to help you with your prescription drug costs. So it may not be you that's in that category, but if you know of someone who's on Medicare, I run into people all the time who aren't aware of this and they're just struggling to even pay for Part B. There is extra help available for those folks. The other side of that coin is there's an income impact if you fall into the high income category. And the high income category, it's called the IRMAA brackets. Every year, the IRS and Social Security are going to work together to take a look at your tax returns from 2 years ago. Whatever year it is, they're going to look at your tax returns from 2 years ago. And if your modified adjusted gross income is over the threshold, this year the threshold is if you're an individual filing, if your modified adjusted gross income from 2 years ago was over $109,000, they're going to add on a surcharge. If you're married filing jointly and your modified adjusted gross was over $218,000, the government's going to add on a surcharge. So the surcharge you can see based on the income categories. If your income was $250,000 for married filing jointly from 2 years ago, your monthly premium is going to go from $202.90 up to $284. So the higher your income was, the higher your monthly Part B premium is going to be. And then they're also going to add on a surcharge for the Part D portion of your prescription drug plan. Yes?
So what if you're divorced and making not that much anymore from that?
They're going to look at your taxes from 2 years ago. If you were still married 2 years ago, that's what they're going to look at. If not, they're going to look at your taxes from 2 years ago.
Okay.
Yeah.
Even though I'm not making that much anymore because I'm single now.
Yeah, so they will, there are exceptions. If they notify you that you're going to have to pay a surcharge, they also let you know how you can appeal. You can appeal their decision if they're saying you owe a surcharge. And that, what you're describing might be a situation where they would grant you the appeal. But this is every month for the rest of the year, and then every year they reevaluate and reevaluate. So it's not a lifetime surcharge, it's every month for the rest of the year. And again, if you disagree with what they're telling you, there's an appeal process. I've had clients who appealed it 3 times and they were finally granted the appeal, but oftentimes they're going to turn you down the first time. Don't just take that as a final answer. If you believe you're right, appeal it again. So. But just want to make you aware of this if you're in that category.
So if you would sell something big, like land parcel or something, that would hit through the years later?
If you sell land or you inherit a house and sell it, anything like that, that's an example of where generally they'll grant an appeal for something like that because it's a one-time thing. So if you have a one-time situation where you sold some land and it really increased your income that way, file the appeal because they may grant you a yes on that appeal. If it's just based on your regular income, they're not going to grant your appeal. So private health insurance options. So there's what's called supplement or Medigap plans. We'll talk about those. There's Medicare Advantage plans, also called Part C, and there's Medicare Part D standalone prescription drug plans. So with Medigap plans, if you're online and you're not in Minnesota, in most states, Medigap plans have a letter following it, like Plan A, Plan F, Plan G, Plan N. In Minnesota, we don't assign the letters. We call them basic plans, extended basic. Some carriers have what's called copay plans, and some carriers have what's called high deductible plans. With Medigap supplement plans, your benefits do not change from year to year. So the benefits are always going to be the same unless an act of Congress changes that, but your benefits will always be the same. Your premium's going to increase every year, but your benefits do not change. With most Medigap plans, there is no network of providers. Any provider across the country that accepts Medicare will accept your Medigap plan. It travels with you if you leave the state or the country, and it will go with you if you locate to another state. The downside to that in Minnesota is Minnesota has some of the highest priced Medigap plans in the country. So let's say you move to, even if you move to a neighboring state, Iowa, Wisconsin, their Medigap plans are half the price of what they are in Minnesota. But if you move to another state, that doesn't give you the automatic right to switch to a Medigap plan in that state because it travels with you. You aren't going to lose your Medigap plan if you move away from Minnesota. If you had a Medicare Advantage plan and moved to another state, you do get the option to enroll in a Medigap plan in that state without the health questions being asked. But if you start with the Medigap plan in Minnesota and move, that's not an automatic that you'll guarantee that you'll can switch to a Medigap plan in that other state where they're typically going to be less expensive. So Medigap plans, they are only your medical coverage. They aren't going to give you dental or vision coverage, and they're not going to give you prescription drug coverage. Medigap plans also will not pay for your annual physical. Several years ago, Medicare changed and they will pay for an annual wellness exam, which really doesn't amount to a whole lot other than height, weight, blood pressure. But Medigap plans will no longer pay for your annual physical. Most Advantage plans will. If you go with a Medigap plan in Minnesota that's similar to a Plan G, you would have a deductible of $283 for the doctoring side, and then you would have no copays after that. If you're a non-smoker, those rates this year run about $330 just for the Medigap medical plan. And then if you want a dental and vision prescription drug, you have to buy plans to add that on. So Medigap plans can get somewhat expensive, but there may be reasons why you want to go that route instead of Medicare Advantage plans. If you wait to join a Medigap plan after 6 months of when your Part B is effective, then you're going to be asked health questions, and if you answer yes to any of the health questions, they'll deny you coverage for the Medigap plan. So those are some things to consider. The other options are Medicare Advantage plans, also called Medicare Part C. With Medicare Advantage plans, they roll everything together for one monthly premium. So you get your comprehensive dental, you get vision, eyewear coverage, free gym membership, prescription drugs, all of that's included together for one monthly premium. And in Minnesota, the Medicare Advantage plans, you don't have a medical deductible that you have to pay first. There are no deductibles, at least for this year, but there are networks. There are some companies in Minnesota where 97% of providers are in network. And for Olmsted County, that's going to be Medica and Blue Cross, or even most of Minnesota. If you chose a Medicare Advantage plan, if you're living in Minnesota with Medica or Blue Cross, 97% of providers are in network with those plans, including the Mayo Clinic and the Mayo Health System. With a Medicare Advantage plan, there are two different types. There are HMO plans and there are PPO plans. I advise people to stay away from the HMO plans because you're very limited. When you travel, you're going to need a referral to see a specialist. There aren't a lot of HMO plans left in Minnesota. The PPO plans, you don't need a referral. You're going to have coverage nationwide and that sort of thing. So if you go Advantage, you want to make sure that it's PPO. One thing I should highlight, if you plan to use, I don't know why you would, but if you plan to use the Mayo Clinic facilities in Florida or Arizona, they do not accept Medicare Advantage plans at those facilities. Rochester does. Let's see here. Like I said, there are networks with Medicare Advantage plans. Minnesota really has the best Medicare Advantage plans, in my opinion, in the nation, in that you have carriers where 97% of providers are in network. I'm licensed in many states. I work with people in Arizona, for instance. A lot of their Medicare Advantage plans in Arizona, they're zero premium plans, they're HMOs, they don't travel well. I tend to recommend Medigap plans to people who are living in Arizona if they plan on doing a lot of traveling. So there's a lot of differences between one state and the next with Advantage plans, but Minnesota's plans are really strong. Yes?
So with the Advantage plans on your, let's say that you have to have a test or an MRI, do you have to have, it has to be, approved done beforehand, versus supplements, you don't have to usually?
That's an interesting question. You said with supplements you don't have to have pre-approval. That's changing. You may have to have pre-authorization with a Medicare Advantage plan. Medica approves 96% of pre-auths within 24 hours. They have the best record in the state for that. But the federal government is starting a test program with Medigap plans where 10 states, starting this year, 10 states, they're requiring pre-authorization. They're trying to reduce costs for Medicare. So if you can see into the future, none of us can, but you know that if they're starting in 10 states, they're going to say it's a success and they're going to roll it nationwide. But so that rule isn't necessarily going to be true moving forward where you don't have to have pre-authorization if you have Medigap.
So what happens on there, you're brought into the emergency room and you need to have this test right now. I mean, you can't wait 24 hours. It
Yeah.
might cost you your life. Do they make exceptions for things like that?
I think they do, yes.
Heart attack or something like that?
Yeah, I haven't had any complaints from people who've gone to the emergency room with Medicare Advantage, but again, it can be different from one carrier to the next. I can tell you the nonprofits, insurance carriers like Blue Cross of Minnesota and Medica, and they have a much better track record than the for-profits like United Healthcare and Humana. The for-profits tend to make you jump through a lot more hoops than the nonprofits do. But of course, if you're using the Mayo Health System or the Mayo Clinic, they won't accept Advantage plans from United Healthcare or Humana anymore. But those are things that are to be considered, but that whole world is changing too. Let's see. Medicare Advantage plans, you're never going to be asked health questions if you enroll in that, and you can change your plans from year to year. Any other questions on those? Okay.
Stupid question.
Yes.
The Advantage plan, does that come out of your Social Security to pay for that?
You have the option with most insurance carriers, you can get a monthly bill, you can have it taken out of your Social Security benefits, or you can have it set up electronically to come out of your credit union account.
Okay, so
Yeah.
you got options.
Yeah.
Thank you.
And then if you go with a Medigap plan, supplement plan, you probably want prescription drug coverage, and there are what's called Part D standalone prescription drug plans. You'd pair them up with your Medigap plan. Each company has a formulary, which is a list of medications they cover and they don't cover. But if you meet with us, that's the one thing, well, it's one of many things we'll do for you, but we're going to ask you to bring a list of any prescription medications you're taking, and we'll look them up to make sure that whatever prescription drug plan you choose, that your medications are going to be covered. It'll tell you what your costs are going to be, if there's a deductible, what your co-pays at the pharmacy, so forth and so on. So we look that up for all of our clients if they want us to. And then every Part D plan, you're going to have different tiers of coverage. So tiers 1 and 2 are generally going to be the generic medications if you're taking any of those. They're the lowest cost. Tier 3 and 4 would typically be brand name medications. Some people are on a Tier 5 medication, which would be a specialty. That's the highest cost medication. And then a few of the plans, a lot of them have done away with this, but some of them have what's called a Tier 6, and that's going to be the lowest cost generic medications. We go over all of that with you if you choose to meet with us and review your plan options. If you choose not to enroll in a Part D prescription drug plan when you first go on to Medicare, I have a lot of people who say, I don't take any medications, I don't want to pay for a plan. You don't have to sign up for a Part D plan, but if you do down the road, because you start taking a prescription, you're going to pay a penalty for the number of years you went without, and that penalty is lifetime. It's going to get added on to your monthly premium, and you're going to pay it every month for the rest of the year. There are low cost, if you go Advantage plans, you're going to get your prescription drug coverage included in that. But if you go Medigap, there are 3 Part D prescription drug plans in Minnesota, and a lot of them are nationwide. For less than $10 a month, you can get an effective prescription drug plan. So my advice to you would be, if you say, I don't want a plan, well, you can get one for $5, but it's your choice. If you don't want to sign up for it, you don't have to. It's your choice. Any questions on that? Okay. And then last year, the government started something new. It's called the Medicare Prescription Payment Program. There's no cost to enroll. Once you do enroll in a plan that covers prescriptions, your insurance carrier is going to send you a form. It's voluntary. If you want to join the Medicare Prescription Payment Program, you can sign up for it. I get calls all the time. Do I have to fill this out? No. Typically, this is for people who are on high-cost medications, and they're going to hit their maximum out-of-pocket. So what's new is there's a maximum out-of-pocket now on prescription drugs. This year, it's $2,100. If you're taking any high-cost medications, generally Tier 3 or higher, some people hit $2,100 in the first few months of the year when they go on. And if you're retired, that can be expensive for some people to try to cover that. So the government's offering this Medicare Prescription Payment Program. If you sign up for it, you sign up through whoever your insurance carrier is, and once you're on it, they're going to bill you monthly for your prescriptions. When you go to the pharmacy, if you sign up for this program, you don't pay anything for your medications at the pharmacy. Your insurance company will bill you for your medications. Again, it's entirely voluntary. You don't have to sign up for it. I think less than 10% of the people signed up for it last year, but it's an option for people who may need help covering the cost of their medications if you're getting hit in the first few months with that $2,100. Any questions? Okay. So premium costs. Again, Part A, you're not going to pay a monthly premium if you or your spouse has worked in the U.S. for at least 10 years. That's the Medicare tax that comes out of your paycheck. This year, Part B, $202.90 for most people. And then Part C plans, in this area, you're looking at, for a good plan, anywhere from $100 to $150 a month. If you go Medigap, if you go with a Medigap plan where you have a small deductible and then you don't have any co-pays, that's going to run you around $330 a month. And then if you go Medigap, you're going to have to add on prescription drug, dental, and vision with Medicare Advantage. That's all together for that monthly premium. So Medigap plans can be considerably more money in premiums per month, but there are reasons why you may want to go with that over a Medicare Advantage plan. If you sit down with us and we go over, I'll ask you questions and we kind of help you narrow down which type of plan are you going to be most comfortable with. So we don't have a preference one way or the other, but we do want to make sure whatever you choose is going to be the one that works best for you. Okay, so with that, like I said, if you want us to contact you, there's this form here that you can fill out. I'll send you a thank you email if you put an email address on there. And then if you don't need help right away, just respond and say, we don't need help right away. That's your option to fill that out. And then here is contact information, especially if you're online. It's our 800 number. Our email address is medicare@trulink.com or dbrown@trulink.com. But it's a way for you to contact us if you have questions or concerns or just need help. Like I said, we are licensed in several states, and we can help you if you need it. Any questions that maybe something I didn't cover or you had questions about when you came in that we didn't talk about? Yes?
You don't deal with any of the cost or anything, or do you know any of the cost of if you're an employee plan going through?
I don't have all the details on the employee plan. I know some retirees can stay. There's a plan, depending on what contract the employee was under with Mayo, they can keep that plan when they go into retirement for Medicare. I don't know any of the details on that.
So that's
Yeah.
where we need to go to Mayo via benefits?
Yes.
Ask?
Yeah, they can, yes, they should be. I don't get the best feedback on it. Some via benefits, people are really good, and other people act like they started yesterday and they don't know how to answer questions. But hopefully you'll get the answers that you need with VIA on those types of questions. If they're Medicare questions, even if you have to go through VIA, we're happy to sit down and meet with you to at least give you some guidance. Yes?
Yeah, Part B, when I called Social Security, neither Austin or Rochester, Olmsted or Moore County, he said you can sign up for Part B same time we sign up for Social Security, and we gotta do it online. They're not taking appointments at the office.
Okay.
So you call up for appointment, it took us 2 months just to get in on a phone call appointment. So anybody that's thinking about it, they better call far enough ahead. You gotta make them wait too long.
Yeah, some Social Security office, I thought they were all open now, but apparently they're not.
Well, yeah, they probably will take somebody if they walk in and they don't
Oh,
call ahead.
okay, yeah.
Go find out. I mean,
Yeah.
you know, but that's what they told me on the phone.
Okay,
Either Rochester or Boston, they take it more, but they make the appointments by phone, and then you pick your Part B at the same time you sign up for Social Security.
yeah,
Well, that's different on
right.
the phone, right?
Yeah, or you can do it online, or you can call us and we can help you. You don't have to sign up for Part B if you're collecting Social Security benefits if your spouse is still working and you're on an employer plan. In fact, you want to delay your Part B if you're going to be on an employer plan, because you don't have to be paying that $203 a month, it does you no good with an employer plan.
So if you retire, say like June 2nd or something, do you make it so it takes over right away, or do you get a month overlap? With
It depends on when your employer plan is going to end. If your employer plan is going to end like June 1st, then you would want your Medicare to be effective for June 1st.
I think you might get a month on the meal plan,
Okay,
but you gotta make sure that.
yeah. Yes, online.
They're asking, what if they're currently enrolled in Medishare or some type of a shared program?
Yeah. So a lot of the Medishare or cooperative plans will offer you coverage when you're 65 or older. I think most of them require you to be on Medicare A and B to go that route. I just worked with a gentleman yesterday who his health, he is up in the cities, Fairview. They told him they won't accept Medishare plans once you're Medicare eligible. And oftentimes that is because you have to pay the bill up front and then you get reimbursed through the cooperative program. But there are plans available for those folks. If you decide to go that route, just make sure that whatever clinic or hospital system you're using, that they will accept that. Yes?
Social Security offices, are they in every county in the state or just
No.
particular areas? Or?
They're in certain locations throughout a state, and it sounds like some of them are not accepting appointments, some are. If you go online, you can just, if you Google what is my local Social Security office, they'll bring up a list of Social Security office for the state, they'll give you the local phone numbers and so forth. But
You don't have to go with the county if you want to go to a different county.
typically, they're going to tell you to go through whatever your local office is. I know some offices make exceptions. Some offices are easy to work with than other offices. So it really depends on whoever you talk to at that office as whether they're going to be willing to help you if you're not in their district or not.
Is there just one social security office in Rochester, downtown?
There's one Social Security office in Rochester, yes.
That's the one.
I don't know if it's still downtown. It is, okay.
Right on Main Street there on, used to be the old Holiday Inn downtown.
Okay,
Right in that area.
okay. Yeah,
So
yes.
is it the social security office I have to talk to because I work and I need to start taking some of my social security to make sure I don't need too much?
Yeah. So if you're still working and you're going to be collecting Social Security benefits, it depends on if you're at full retirement age or not. If you were born in 1961 or later, that your full retirement age is 67. And then,
I'm gonna be 68.
if you're beyond the age of 67, you can make all the money you want and collect your Social Security
I don't
benefit.
have to worry about that.
You don't have to worry about it. Yeah. Once you reach full retirement age, you can make all the money you want from another job. Yeah. The maximum benefit is if you don't start collecting till age 70, that's going to be your maximum monthly benefit. But once you reach full retirement age, you can make all the money you want.
Someone said they'd be taking my social security away.
Well, they'll reduce your benefits if you start collecting Social Security benefits and you're making too much money, whatever the threshold is, in another job. If you're not at your full retirement age yet, they'll reduce your Social Security benefits.
If I am,
Then if you're at full retirement age, then you can make all the money you want. Yeah. Yes?
Do they make it yearly increase in benefit amounts? Like, it's not like getting a raise, but I mean, you need that if your other benefits go up,
Yeah.
For what you're paying in.
So typically every year in October or November, it gets announced what the increase in Social Security benefits will be. So that does tend to go up a little bit. This year's was one of the smallest we've had in a while, increases, but it's called the cost of living adjustment, and they come out with that in October or November of each year. So if it's not good and it's an election year, they'll announce it after the elections. If it's good, they'll announce it before. People laugh, but it's true. There's a history of that. Yeah.
Well, there's been years when it's been zero.
Well, and just be aware, I mean, they are projecting Social Security to go bankrupt in 2032 or something. So, Congress will wait till the last. Here I am getting political, but Congress will wait till the last minute, and it's going to affect the high-income earners first. So, Yeah. Well, if you have any other questions, you're welcome to talk to me afterwards, but thank you for coming. Were there any more questions online? No? Well, thank you for attending, and like I said, if you fill out that card and leave it with me, I'll send you a thank you email and ask you if and when you need help, but appreciate you coming today. Thank you.